Hi, welcome to my today's classroom. In my today's classroom, I will be discussing about pregnancy and liver diseases. Now, whenever a lady is pregnant, how to evaluate that lady if she is suffering from liver disease, whether it is an acute liver disease or it is a chronic liver disease, how to evaluate that patient. Now, the liver diseases which are usually seen in cases of pregnancy, one is acute fatty liver of pregnancy. Now, in this acute fatty liver of pregnancy, which is usually seen during third trimester of pregnancy, in the acute fatty liver of pregnancy, patient may present with cholestasis. Patient may present with hepatic encephalopathy, fulminant type of hepatic failure. Patient usually present with features of bleeding tendency because of acute liver failure. So these patients, they may present with acute fatty liver. So if this acute fatty liver is present in during pregnancy, then in those cases chances of intrauterine death are more. Chances of premature delivery are more. Intrauterine fetal growth is delayed. So these are the usual complications of acute fatty liver of pregnancy. So I will repeat that in acute fatty liver of pregnancy, patient may present with fulminant hepatic failure, patient may present with cholestatic jaundice, patient may present with bleeding tendencies, and in these cases, there is intrauterine growth retardation, intrauterine fetal death, and sometimes premature delivery. Mortality of patient during pregnancy is also increased in this acute fatty liver of pregnancy. Apart from this, sometimes suppose if patient is already suffering from cirrhosis, then what will how you will evaluate that patient during pregnancy. Usually incidence of pregnancy in cirrhosis is very low. But whenever cirrhosis is present and patient becomes pregnant, then in those cases, usually the usually patient is advised not to continue the pregnancy because chances of again intrauterine fetal death are more, chances of premature delivery are more, and chances of variceal bleeding also increases in these cases during second trimester of pregnancy and even in third trimester of pregnancy. So usually it is advisable not to continue pregnancy if patient is cirrhotic. If patient is suffering from primary biliary cirrhosis, in those cases usually steroids are given. Again, in cases of primary biliary cirrhosis, if your patient is already on steroids and if she becomes pregnant, then again intrauterine fetal death and intrauterine growth retardation are more. Mortality also increases in patient. Therefore, it is advisable not to continue pregnancy in cases of cirrhosis. Now, there is one condition known as Budd-Chiari syndrome. Now, in Budd-Chiari syndrome, there is hepatic vein thrombosis. Usually, in cases of pregnancy, this hepatic vein thrombosis is seen in ladies who are taking oral contraceptives for a long time and after that they become pregnant. So, in the cases of Budd-Chiari syndrome, that is hepatic vein thrombosis, these ladies they will complain of pain in right hypochondrium, and during examination there is slight tenderness in the right hypochondrium. These patients may later on develop jaundice. They may develop portal hypertension. So because of portal hypertension, again one of the signs of portal hypertension is esophageal varices. These esophageal varices may rupture during pregnancy. So in the cases of Budd-Chiari syndrome, the only treatment is to prevent the Budd-Chiari syndrome. If Budd-Chiari syndrome has already occurred, then in those cases we can have a surgical approach. But usually if Budd-Chiari syndrome develops, again the prognosis of pregnancy is not good. So usually again it is advisable in Budd-Chiari syndrome not to continue the pregnancy. So this is again one of the disorder which is seen together with pregnancy. In hepatitis A, E, B, and C. In cases, usually in pregnancy, hepatitis E is very common. If patient develops hepatitis E, the patient should be managed immediately, symptomatically, and if it continues, hepatitis E, if it is prolonged, usually it is prolonged in the cases of pregnancy. So if it is prolonged and enzyme levels are very high, then in those cases prognosis is not good in pregnancy. So the earliest the hepatitis is detected and it is managed, it will be good if managed earliest in the pregnancy. Similar in hepatitis A. Hepatitis A, if it develops during pregnancy, then prognosis is not good. Then one question arises, suppose if patient is hepatitis B positive, she is suffering from chronic hepatitis, if she becomes pregnant, or if whether the hepatitis B virus will be transmitted in fetus or not. If patient has developed acute hepatitis B, then in those cases, in first trimester of pregnancy, if patient becomes hepatitis B positive during first trimester of pregnancy, then chances of transmission of virus to fetus are less. But if patient becomes positive during second and third trimester of pregnancy, then definitely there are chances of transmission of virus in fetus. In cases of second trimester of pregnancy, it is 25 to 35%. As the pregnancy continues, in third trimester of pregnancy, it goes up to 70%. So in 70% cases, disease may transmit in fetus. Fetus may become hepatitis B positive. And when child is born, he or she may be hepatitis B positive. But if in first trimester of pregnancy, if patient develops acute hepatitis B, then chances of transmission are less. If patient is suffering from chronic hepatitis B, then chances of transmission of hepatitis B virus are more during pregnancy, right from first trimester to the last trimester of pregnancy. In hepatitis C cases, in hepatitis C, it is not transmitted in fetus. So in cases of hepatitis C, pregnancy is relatively safe. Now there is one condition known as hypercholesterolemia, that is increased cholesterol level. Cholesterol level is increased during pregnancy. In bile, secretion of cholesterol is increased. So as a result of this, gallstones and choledocholithiasis, that is bile duct stones, are more common during pregnancy. This is because of hypercholesterolemia. So this is again one of the condition which may cause disturbance during pregnancy. Usually the investigations are confusing type in cases of pregnancy. If we see the enzyme levels, SGPT level, SGOT level, serum alkaline phosphatase levels, these levels are usually increased during pregnancy. Even in hepatic disorders, it is increased. But in a normal pregnancy also, the levels of these enzymes are increased. This is because of secretion of these enzymes from the placenta. Alkaline phosphatase is increased to a large extent in cases of pregnancy. Again, this is because of secretion of this enzyme from placenta. So even if there is no liver disorder, then again without liver disorder, the enzymes may be found to increase. When we see the protein level, serum albumin level, this goes down. Serum albumin level is low in these cases. Blood urea nitrogen level is low in the cases of pregnancy. So in the case of pregnancy, when you evaluate various parameters, biochemical parameters, this may create confusion. One of the tumor marker is alpha-fetoprotein. This alpha-fetoprotein is found to be increased during pregnancy. So it doesn't mean that if it is increased, that means that there is hepatocellular carcinoma. It doesn't mean that there is hepatocellular carcinoma, because many a times it is increased during pregnancy. Again, this is because of increased secretion of this alpha-fetoprotein from placenta and increased synthesis by the liver cells. So the various biochemical parameters are also disturbed in pregnancy, even in normal pregnancy. So it may create a confusing pictures. So these are the few conditions which may produce a confusing picture during pregnancy, and these are the various disorders which of the liver which are usually seen with pregnancy. Thank you.